Thanks so much, Chris, and thanks to all of our folks with the opening remarks. I also want to recognize Jeffrey Sheridan from Congressman Louise Slaughter's office and Frank McAvoy from the New York State Comptroller's office who have joined us today. We will have some others joining throughout the day, and certainly encourage folks to ask lots of questions and share your thoughts and feelings. So with that, in the morning session, we'll actually move right through what was a little bit of a break period, but we'll start right up to get us back on time with the company presenter session. And with that, our first company presenter session will include Oyogen, Microgen Systems, Floralogic, Viafora, C-Cubed, and LifeCell DX. As you all see here, we've got noted who will be presenting, but we also want to note the SEC statement, which we'll present to you the beginning of each company session. Cell phones, again, please have those on silence, and feel free to take your calls outside the room here. We are most pleased to have a moderator for the session from Phillips Lytle. I'm pleased to be introducing Jennifer Beckage, who's an associate there. Jennifer is not only an attorney at Phillips Lytle, but I was pleased to learn that she actually is a former entrepreneur and startup person herself. Right now, she handles emerging and established technology-focused companies and related clients. But before she got into law, she was an owner and manager of operations of EdgeNet, a Buffalo-based company that developed internet programs and other cutting-edge web technologies. So pretty exciting to hear that she's got this terrific, eclectic background. So with that, please welcome Jennifer to introduce our companies.
Good morning. As Marnie mentioned, I'm an attorney at Phillips Lytle, and I just wanted to let you know a little bit about Phillips Lytle. It's a full-service law firm that assists investors, entrepreneurs, and advises their clients on numerous cross-border issues. And on behalf of Phillips Lytle and all the other sponsors and participating organizations, I do want to thank Marnie and the rest of the Center of Excellence and all the committee members of the BRIGHT Buffalo Niagara Committee for all their work. Their collaborative efforts have really helped strengthen this area as a top technology corridor. Sorry. So we have 6 companies that will be presenting. Each will have 10 minutes. After they're done, stop by, introduce yourself, and we'll go ahead and get started. The first presenter is Dr. Harold C. Smith, founder and CSO of Oyogen.
Good morning, everyone. I'd like to thank the sponsors and organizers for giving Oyogen the opportunity to speak. My name is Harold Smith, and I'm the founder and chief scientific officer of Oyogen. And Tom Fitzgerald has joined me today, the chief operation organizer. He's in the back and will be willing to talk to you as well. So briefly, what I'm going to tell you about today is that Oyogen is a biotech company founded in 2003 on a technology that's known as editing enzymes. These compounds, these enzymes modify the human genome in ways that help us get through disease. And it was founded by myself from the University of Rochester. We are engaged in drug development and drug screening for infectious disease and hope to eventually branch into cancer. The company has actually validated 2 new proteins that are incredibly important for HIV to take hold in our body, and develop compounds in 2nd-generation medicinal chemistry now. And drug screening takes place in a state-of-the-art lab in Rochester, New York, off the site from University of Rochester. So what is the marketplace? This is an incredibly productive marketplace for developing new drugs, because the virus has the ability in a 5-year span to outstrip any kind of drugs that we have in the market. So there's a continual need. The prevalence remains high. Those of you who received USA Today know on the front page that 20 to 30% of people who are HIV positive don't know it, and the infection, while it can be controlled in people who have been diagnosed, is really still very much out of control in terms of its spread, not only in our nation but in developing nations. Every first-in-class drug that's developed against HIV becomes a blockbuster drug. And so that's what the opportunity is. And markets show that this is a sustained growth. Gilead has come out with 3 drugs combined into 1 compound called Tripla, and that's expected to reach $4 billion in 2013. So what's the investment opportunity? Well, Oyogen is in round C, raising $3 million. We've raised about 1.5 of it so far from the local community. And we are using those proceeds to actually move 2 compounds forward, 2 novel compounds on HIV through medicinal chemistry, live virus testing, and animal testing. And our milestones will be that we believe in 12 to 18 months we will be talking to the FDA seeking approval to do clinical trials with these 2 compounds. So this is moving incredibly fast for our company. Oyogen started out with a modest investment from the University Technology Seed Fund. We subsequently, in 2005, had an angel round investment. In 2009, an additional $1.5 million came in that developed our whole capacity and moved us into our own footprint as a company outside of the university. And now we're in this angel round trying to bring our 2 compounds to bear to the FDA. So the management team is strong. Tom Fitzgerald, who is here with me, has numerous years of experience with the major pharma, both as a corporate lawyer, but also as an advisor for a major player such as SmithKline Beecham. He is also extensively involved in the Rochester community, helping other small businesses decide how to become full-fledged businesses. I am a University SUNY Buffalo PhD graduate in molecular biology. After some time at Baylor College of Medicine, I went to Rochester to take my faculty position, where I discovered these editing enzymes and have realized that there's great potential in moving those forwards into drug development. I've received many NIH grant awards to sponsor that research, and I'm also a Bill and Melinda Gates grant recipient for the work that has led to this company's development. The Scientific Advisory Board is really non-paral. It's like having Coca-Cola or Pennzoil on the side of your racer. We have David Ho, who's the chairman of the Aaron Diamond AIDS Institute, professor at Rockefeller. He's internationally recognized as one of the leading people in trying to cure HIV. He was formerly Presidential Medal winner from Bill Clinton's time, Time Magazine Man of the Year. In addition to that, we have a chairman of biochemistry at University of Rochester, Dr. Bambera, and chairman of microbiology, Steve Dewhurst. Both of these are HIV specialists, world-renowned people. And Richard McCloskey is helping us transition from assay development, drug discovery into clinical work. And he has had an amazing career as an MD for infectious disease and also as a scientific advisor for Endo Pharmaceuticals. He's also serving as consultant for J&J. So we feel we have the horsepower in Oyogen to hit our goals with this round of investment. So now what I want everyone to do is tighten your seatbelts firmly around your waist, because I'm going to give you 3 slides of science. That's all that's in this talk, is 3 slides of science, but usually people start leaving the room. What is my favorite part? What is the HIV editing enzymes? This is a class of 14 proteins discovered when the Human Genome Project was revealed. They interact with our human DNA, and they change the sequence of DNA in very special ways. They also can attack viruses. They change the virus's DNA in such a way, or its RNA in some cases, so that the virus becomes crippled and impaired. The understanding that these enzymes existed put everyone back in their chair. No one really knew that we were changing genomes so much by a set of enzymes. They're expressed in different tissues. And so I've embraced the one called A3G. This one is a natural defense against hepatitis, HIV 1 and 2. And so 3 different viruses right off the bat. What it does is, while the virus is trying to reproduce itself, it seeks out the virus and starts mutating its genome to where it can no longer make any sense of itself. It totally impairs the virus. But this virus is extremely clever. Like all retroviruses are, it has a code for its own protein. In this case, it's called VIF, viral infectivity factor. VIF seeks out our host defense, grabs a hold of it, and forces our cells to destroy our own host defense. So just what we need to defend ourselves, the virus understands that and takes that away from us. Understanding that academically has enabled us to develop methods to try to reverse that effect, to impair the virus's ability to attack us. And so when we do so, we can suppress HIV. Now, if that was just a simple enough story as it is, then we might be further along in terms of everyone having drugs against it, but this is a stylized cartoon of what's happening to a cell when HIV comes in. The first thing that happens is your cell responds to the fact that it's been infected by a shock, and it tries to reverse everything that it's doing in order to defend itself against the virus. Part of that is shown in the green wrap around the yellow kind of thing called A3G. I don't seem to have a pointer here, but that totally inactivates our host defense. So the virus can slip by the sentinel. The sentinel is asleep. Then once the virus replicates itself into DNA, it inserts into our chromosomes. You have it for life at that point in time. And then it expresses itself as an RNA genome again, codes for protein that'll package it. But one of those proteins that it makes late is this VIF protein, which gets together, finds our host defense A3G, zip codes it for destruction, and totally renders us defenseless against HIV. This discovery is 9 years old that this is happening. And so we now have compounds through second round medicinal chemistry that take the RNA off of 3G and activate preemptively a defense against HIV, so incoming viruses can be stopped, and also tackle this VIF protein so that it can't bind to our defense and prevents the destruction. This double action way of approaching it is absolutely unique in the HIV field. So we feel like we have knowledge from our partners and interactions that we are actually #1 as far as this goes. So in brief, the science can be summarized in this rocket ship model. The HIV protein VIF has to form a fulcrum like a pair of pliers. We attack that point. We have compounds moving forwards. It has to grip our host defense called 3G. We have an assay that's now developing compounds for what we call 2 and 3. When the virus infects us, it turns our host defense off. That's the RNA binding. We have drugs that are going through phase 2 medicinal chemistry that activate 3G by taking the RNA off. And this week we started developing the assay for #4, which is the zip code that tell the cell to destroy our host defense. So this is a highly advanced platform in a therapeutic developing company. Basically, our trajectory is as follows. We're at the point where we're looking at 18 months in round C. For all intents and purposes, we're in the first quarter of that upswing. This is showing basically how many dollars have been invested versus what we think the valuation of the company is. It's considered to be now $10 million. With this round C, we will have 2 drugs that are ready to talk to the FDA about clinical trials, and at that point in time, the next $5 million round in round D will basically bring us through phase 1, 2A of clinical trials. So in summary, I think this is a very unique investment opportunity, not only because we're first in class in our compounds, but because how far along we are. The focus is on the discovery of new drugs. Every opinion leader from academic to industrial recognizes that Oiagen is there in the lead. And Oiagen holds a commanding position by its IP estate and also the knowledge that we have our assays. In the next 12 to 18 months, Oiagen's goal is to have these 2 compounds ready for the FDA, and those are realistic timeframes given where we are today. And of course, we're in discussions now with all the major players in the HIV pharmaceutical industry who are looking at us for potential M&A within the next 12 to 18 months. So I want to thank you very much for your attention and listening to science this early in the morning. I'll take any questions later on. Thank you.
Our second company is David Hessler, CEO, Microgen Systems.
Good morning. I'm David Hessler. I'd like to thank the committee for giving us an opportunity to be part of this forum this morning, and we're really flattered to be in such august company. I'll apologize in advance for my cough, and hopefully I don't hack in the middle of the presentation. Microgen is a clean tech company. We've been in existence about 4 years. We consider Cornell our primary office. That's where we spend the bulk of our money. The management team is at High Tech Rochester in Rochester, and we are also have a visiting office at the Clean Tech Center in Syracuse, New York. What does Microgen do? We build something called a vibrational energy harvester. In our case, that vibrational energy harvester is a small computer chip about the size of a dime that when it vibrates, it puts out minute amounts of electricity. It's shown schematically there on your right, and that is an actual picture of the product under test at Cornell. It's about this size, and that's what we are in the market to build. What I'd like to leave you with this morning is a summary that says we're addressing a growing market. We've got a transformational product that is both patent protected and is covered by a lot of in-depth proprietary knowledge and trade secrets. The product has been brought this far with contract revenue so that there's been very little or no dilution to the cap table, and the product's ready to launch. We've got a very strong management team. We know how to do this. We've done it before. And we have the potential for high investor returns. We've got very attractive deal terms. Our capitalization strategy has impressed most people that have looked at our path to revenue and profitability, and it's a market that is ripe for exit potential. What's the market that we're serving? It's something called the, the wireless sensor network market. That market is growing quite well now based on the market need and emerging technologies. These wireless sensors can be placed in buildings and on bridges and so forth. The problem is the growth of that market is currently being held back by the need to replace batteries. When our product is on the market, those batteries will last in excess of 10 years, and that market will grow explosively. Think of us as a battery charger. A busy slide to talk a little bit about the wireless sensor network market. The graphic on the left simply tries to illustrate that in the good old days, this was a technician with a clipboard that might walk out to a machine, take a reading, walk back and enter that data in some sort of a log at the very top. Over time, that quickly migrated to onboard sensors in those machines or in those bridges that was hardwired back to the central computer. And increasingly today, that's done wirelessly, where those signals are transmitted back to the recording device. On the right is a graphic that simply says that to maintain the cost of one of those nodes today over 10 years is quite excessive by the time you add the price of the batteries and, more importantly, the labor to change those. And with our product on the market, we have the potential to reduce that cost by about an order of magnitude. A little bit more about the wireless sensor network market, and a market that is important for you to understand our value proposition. Those red boxes on the left are nodes, or sometimes called motes. They're about the size of a deck of playing cards or sometimes a hockey puck. The common thread is that they have electronics on board that monitors, it could be pressure, it could be temperature, it could be vibration. They're placed ubiquitously around a building or on a bridge. The other common thread is that they all have a small radio on board, and they chirp their information from one to the next in what is called a mesh network, until ultimately that information goes back to the host computer. And the other common thread is that they're all battery powered today. What are the applications for those wireless sensor networks? Many of you that are in the clean tech space have heard a lot about smart buildings and the smart grid. We argue that there will be no smart buildings or no smart grid without the growth of wireless sensors. The two technologies are in companion comparisonship. I've shown some other examples of applications here, and many of you actually, whether you know it or not, are users of a wireless sensor network. Anybody that owns a car in the US built after 2007, today your 4 tires talk to your instrument panel constantly over what is called a tire pressure monitoring system. Again, Harold referred to the headline in the USA Today, and I noticed at my hotel they talked about SUV safety has gone way up ever since they've had onboard sensing devices to keep from rollovers. This was part of it, the famous rollovers where tire pressures were found soft. So you have a wireless sensor network. By the way, it's an application that many of us covet because you can imagine it's 50 million units a year. Here's another picture that helps to put in perspective why wireless sensor networks are so valuable. This happens to be a Wheeling-Pittsburgh steel mill. What you're seeing is hot steel going under a set of rollers. Those rotating parts, those motors and those rollers, need to be monitored constantly to make sure they don't seize up, but they're in vibration. You can imagine what happens if that seizes up and that steel stops flowing across there. This was deemed to be too hostile an environment for a hardwired solution, so the users have put a wireless sensor network in there to monitor the condition. important point, somebody has to go in there and change the battery on those sensors, however. So if that's the problem, what is our solution? As I said, we are building what is called a MEMS-based piezoelectric vibrational energy harvester. A lot of big words, a fancy title. It really is rocket science. What's important for you to understand this morning is that it's a unique proprietary design. It was developed under patent at the University of Vermont by my co-founder. It's been 4 years under development, first at Vermont, then the Infotonics Center in Rochester, and more recently at the Center for Nanofabrication at Cornell. The product will debut later. In fact, my partners are just returning from a trade show in Chicago where we successfully ran this product for 3 days, and we had our first opportunity to power one of these wireless sensors at a trade show just now. And we have our follow-on products already planned. When I talk about power requirements, by the way, I'm not talking about today's D-cell or AA battery or even the coin cells that some of you are familiar with from small devices. We're talking about a form of power that's even smaller than that. About midway up this chart, our partners tell us if we can produce 100 microwatts of power, we can keep these batteries, the new generation of batteries that are used in these things, going indefinitely. That's our target, and that's the kind of numbers we're hitting based on our prototypes out of Cornell. What's the status as of this morning that I'm talking to you? Our management team is in place. Our business infrastructure is quite far along. We have excellent legal and accounting support. We've established our offices. We're beginning to buy small amounts of capital equipment to get the job done. We've got an excellent advisory board. We're very proud of the fact that we're one of 2 recipients of a $1.2 million NYSERDA technology commercialization contract. This is something new that NYSERDA has done starting last year, and that will fund us through the balance of this year and early into next, and it is exactly to execute this commercialization to get us across that valley of death. We're partway through a $1.2 million capital raise. We have $300,000 of that money in the bank. We're looking for the rest to close that out over the summer. And as I said, we've got that first product ready to launch. This is not a business plan for the faint of heart. This is a difficult market. It's a latent market. There's a complicated channel strategy. So we have one of the best management teams of any company at our stage of growth. We have over 150 years of combined experience. This is my 4th time around. My partner, Mike Parada, has done this 2 or 3 times. Robert is the inventor and the technical genius behind this. So we think we know how to get this done. We've done it before. If this is a good market, what about competition? We put it in both direct and indirect competition. On the direct side, the products that are out there today are much bigger than us and they don't scale down to the relevant market. On the indirect side, many people will be happy or content to keep changing batteries, and photovoltaics can do part of what we do. How do we address the market? Like many, it's multi-tiered. There are a group of component suppliers who sell to wireless sensor network suppliers, who in turn sell to end users and systems integrators. We're in discussion with everybody on this chart. Everybody knows about our progress and is anxious to see us succeed. Later this year, we'll sell to at least those first 2 levels. How do investors look upon us? They're happy that the research is complete. It was done on somebody else's nickel. They like the capital raise. They like the NYSERDA grant. We can be highly profitable. Most people that look at our financials agree we can be 20 to 25 million with a 20% EBITDA fairly quickly. And most importantly, there are logical exit opportunities. We're already talking to people about our follow-on round in 2012, and we're flattered that we have world-class venture capitalists in the clean tech space following our progress today. We keep adding to the management team. We are bringing new hires in from out of the area because they're attracted by the MEMS cluster that's developing in Ithaca. So we're part of a brain gain here in New York State, not part of a brain drain. And where I would leave you is that summary that says we're addressing a growing market. We have a transformational product that really is going to change this industry. We have a strong management team, and you take that together, we think we have a potential for very high investment return. We're very pleased to join the growing MEMS cluster here in Central New York with the next successful high-tech company. Here's a few of the people that have helped us get this far, and here's a picture of our product. And I'll be happy to take questions during the break, and thank you very much for your time. And I made it without coffee.
Our next presenter is Laura Weller Brophy, CEO of Flora Logic.
morning. I'm Laura Weller-Brophy, CEO of Fluorologic Incorporated. It is a pleasure to be here today to be able to speak with you, to tell you about our company and about the non-invasive, light-based cervical cancer screening that we are developing. Oops, and that's not it. Fluorologic is a seed-funded startup. We were founded 3 years ago. We are actively seeking an established medical equipment partner to join us in the development and commercialization of a light-based probe to screen for cervical cancer, positioned to replace the Pap tests currently used for screening. The light-based system addresses issues that are limitations of the current Pap smear. While the Pap smear has been around for over 50 years and it has reduced the death rate by 80% in the United States, it has limitations. Pap screening, first of all, can be inaccurate. Of the approximately 60 million women who are tested each year, between about 3 and 9 million women receive a false positive result. This means that women who otherwise have normal cervical tissues are told that they may have significant precancers or cancers. That means that they have to go back to the doctor's office, they make additional 1 or more appointments, and each woman, it is estimated, will have a healthcare cost of at least $200 in those follow-ups. Tomorrow, if somebody's standing here at the stage, between now and then, our country will have spent about $20 million on these unnecessary procedures. Another limitation is that the Pap smears will produce a result for a patient in over 2 weeks. Between 2 and 3 weeks are typical. A doctor takes a sample, the sample goes to a path lab, the path lab prepares it, views it, renders an opinion, which is then transmitted back to the doctor, maybe or maybe not to the patient. Those 2 or 3 weeks can be stressful times. Where pathology labs are not available, Pap screening doesn't happen. Cervical cancer screening is very limited. That means that tomorrow again, by this time, 500 women will have died in the world of cervical cancer, largely unnecessarily because they don't have screening available to them. At Fluorologic, we have a solution that addresses these limitations. We are developing a light-based probe that images the cervix. It does not take tissue samples. Light, which is introduced by the probe to the cervical tissues, causes the tissues to fluoresce. They emit light. Our illumination light is selected so that the tissues and the biocompounds that are most closely associated with cervical cancer emit light that we can image. Those images then will indicate regions that are either suspected to be precancerous or cancerous, so that a doctor can immediately begin to offer consultation to the patient and next steps can be taken. Lab-based results indicate that the illumination light we use and the fluorophores we look at will provide results that are approximately 90% accurate. And there's a lot behind accuracy that I'd be willing to talk to you about later today. Our probe design has been vetted through voice of customer interviews with physicians, oncologists, and surgeons. We have a probe that comprises a slender body which is inserted into the patient's body. There is a sheath which protects it. It gives a sterile boundary between the patient and the device. Light exits the end of the device. Images are formed using 2 cameras that actually integrated into that device, and then a computer control system, not shown here, processes those images and produces false color renditions of regions of the cervix where further evaluation needs to be conducted. We have patents pending on novel and beneficial aspects of this device. We have 2 international patents pending with broad method and apparatus claims. We have additional IP in generation this summer. We're going to keep our patent attorney pretty busy. We're going to be doing international filings this summer. We've run a preliminary clearance. We don't see any issues on freedom for use, and we'll continue to update our clearance as we go through the development procedures. The market, like most of the products you're going to be hearing about this morning, is substantial. The market itself comprises in the United States, about 100,000 practitioners who will offer Pap smears. The addressable market the Fluorologic is focusing on is the 16,000 gynecologists who offer most of the Pap smears today. As an example of the financial opportunity, If those 16,000 systems were to be sold, it would comprise about a $500 million market opportunity. Now, I told you that there was a system and there was a sheath. Every time a patient is seen, a new sheath is used. At maturity, we estimate that in the United States, with those 16,000 systems, we'll be using over 20 million disposable parts per year, generating approximately $250 million of revenue per year in the United States alone. Our device has benefits relative to Pap testing, as I've been articulating, that are valued not only by the patient, but by the physician and third-party payers. Patients like the fact that there will be a painless, minimally invasive test that does not necessitate the removal of cells or of biopsy samples. As I've noted, it can significantly decrease false positive results. I showed you earlier that we have data that shows that it's a very accurate test, and by that I mean that our initial data suggests that we can cut the current false positive rate by 50%. So that $20 million that was being spent each day on unnecessary health care, we believe that we can cut down to about 10 million per day of unnecessary health care costs, and how to alleviate the pain and suffering of women who otherwise are told that they have precancers when they don't. In addition, the system is poised to provide a screening result at the time of test. It's provided by the physician or the nurse practitioner. It does not require a pathology lab to assess the results. When we've done interviews, voice of customer interviews with physicians, what they like best is the improved accuracy and the efficiency in dealing with patients. So you can ask, well, do you want the new revenue? No, they don't want the new revenue. What they are most interested in is being more effective and efficient with their client base so that they can see more patients for more ailments that are of a critical nature. Fluorologic has taken a rather novel approach to our product development. We have used fluorescence screening actually with dairy cows to sense for pregnancy. And during the last few years that we've been working on that project, we've been able to go through several engineering rounds on the equipment. The equipment is not altogether that different from the cervical cancer system. So we've learned how to do the integration of the electronics, of the light sources, develop the software, and develop a very robust unit. When you're working in a dairy barn, you have to take a piece of equipment that can survive a rather hostile environment. So we've gone through those learnings, which are actually very difficult to go through when you go into FDA trials, because if you want to make any substantial engineering changes, you may have to start your trials over again. So we've built our engineering up through our animal studies. We have a development plan in place that includes ex vivo studies at Strong Hospital in Rochester, as well as in vivo clinical trials at Beaumont hospitals. Those plans and people are in place waiting for funding. I've been in industry for over 25 years, and forming my own company has been a very liberating experience because I'm able to put together a dream team as a development team. Our team comprises technical experts as well as consultants from the Rochester region who have been working with us for over 4 years. We've added the expertise from Strong Hospital and Beaumont hospitals for clinicals. And when we get funding, we'll be hiring a statistician, software developer, and lab tech to help roll out the development of our product, as well as adding a regulatory compliance officer and financial officer once we enter into partnership with a partnering organization. Partner attributes. It's very important in the medical industry to work with a very strong partner with experience in FDA trials and taking medical equipment to marketplace. We've identified 10 partner companies, and we're beginning contacts with them now who fit these criteria, have women's healthcare products, and are in diagnostics. This year, we're focusing on getting a first round of investment. We're asking for $370,000, which will be used to develop the full bioprobe system and do a first round of ex vivo studies. We're also looking at medical equipment partner development this year to help us to fund then the rest of the development procedure and to enter into the clinicals. The partner that we ultimately will work with will have funding through 2 mechanisms, which are pretty standard practice in the industry. A first mechanism is through license royalties, which are shown here. When the product is finally commercialized, the royalties scale, obviously, with the sales. When we enter sales, there will be income from system sales and disposables, And the number here just simply shows that the number of systems would scale from about 32 to 240, which were pretty reasonable rates, just to give you kind of an idea of where this may be going. I have over 20 years in industry. I'm a U.S. patent agent. We have David Gottfried, who is an equity partner who supports business development, helping us to get funding, relationship building, specifically with government agencies. Mr. Robert Eklund is a past executive vice president and president of Corning Incorporated. He's helping us with business development and especially with finding a partner company. And Herb Ego is a serial entrepreneur. He's done Biomed before, and he's giving us advice on how to negotiate this state of where we are today in the pre-seed funding. I look forward to any questions you may have and further discussions when we have a break. Thank you.
Our next presenter is Jesse Moynifer, co-founder and CEO of Viafora.
Hello everyone, my name is Jesse Moynifer and I'm the founder and CEO of Viafora. I'm here to talk to you about how we're driving today's conversations online. Now this was an actual topic that started the company for us. I'm a big sports fan. I'm also a big passionate fan of talk radio. And this was a debate that was going on as I was driving from Toronto, Ontario to Brantford, Ontario, which is a 45-minute drive. Who is the greatest boxer of all time, Muhammad Ali or Mike Tyson? Now, I had a lot to say about this, and as far as I was concerned, the idiots were calling in and voicing their opinion that Mike Tyson was a clear choice. So I decided to call into the radio station only to be on hold for 45 minutes until I reached my destination to be told by the moderator that the show had ended and that I wasn't able to voice my opinion. I took that frustration online to ESPN.com and found the identical same debate. Naturally, I was excited to engage in conversation again. Now, the only thing I had available to me was this, a commenting technology, which left me completely frustrated as a user online. Now, I'm not the only one feeling this level of frustration. As a testament to this is the fact that people love communicating through social technologies. 2010 saw 152 million blogs, 25 billion tweets, and 35 hours of video uploaded to YouTube every minute of every day. Now, the sites that are benefiting most from this online trend are social media giants like Facebook and YouTube that collectively have 900 million unique visitors. When you compare that number from such young companies in comparison to established publishers that have been around for a much longer period of time and actually own the content, Facebook and YouTube are driving 3,000% more monthly visitors. So it begs the question, why and how? Well, it's because the social interactions created on those sites is limited to text-based technologies. That leaves the user with the inability to express their opinion, to interact ultimately with the other users on the site and engage with that brand. This, believe it or not, is what you have today and what publishers are using to engage consumers like myself. A commenting technology, as you saw on ESPN.com, and if I'm lucky as a user, I may get a forum. Again, text-based and completely dated to the tune of 10 years. This is Viafora's idea of a new age commenting solution. We embed into the publisher's site right underneath their article, allowing the users to not only upload text commenting, but also blogs. They can drop in a video that's related to the article. They can record themselves and their opinion. And for the first time on the internet, you can have a split screen video debate with anybody that you disagree with on that publisher's site. This is the New Age Forum, again, allowing the users to go into that section and build a community, to leave debates to be picked up by other users, to upload blogs for consumption of other users. Text, audio, and video are different methods that we use to engage users. Then we take that entire experience and we wrap it with gaming. So the more interactive you are on the site, the more debates you win, the more you tweet and comment and invite people to, let's say, CNN.com, who's actually one of our clients right now testing the product, you get rewards and ranks. You're given points, so you can wager points in debate format and take other people's points away, which ultimately gives you an elevated personality on the site, and it can also be redeemed for merchandise at the end. So what is Viafora? Well, Viafora is a technology company that's developed a suite of social media applications. We do this through multiple technologies, one of which is our patent-pending split-screen video debate technology. The entire platform is available on desktop, mobile, and tablet. We further incent the user to stay engaged, as I mentioned, through the gaming platform that we have, which consists of contests, rewards, and rankings. Then we take the user's interaction and run it through our algorithm and behavioral analytics software that determines what they're talking about, who they're engaging with, and what is the interest level. We feed that information back to our client that uses it for targeted advertising towards the users online. Addressable market is within the worldwide collaborative applications space, which consists of conferencing apps, messaging apps, and social platforms. Viafora plays in the social platforms component of this pie, which interestingly enough is the fastest growing out of the entire pie, to the tune of 41% CAGR over the next 4 years, which will represent a $1.8 billion opportunity to us. There is competition in the space, no doubt. It's a very active market. Companies are and it's also very hot. Companies are getting picked up with reasonable market penetration. Pluck, with $10 million in revenues, was just recently bought for $75 million. Says Who was bought by Echo, and you can see the rest of them up there. Now, these companies are still predominantly text-based, and video is really catching up. Video inventory is very tough to get right now, and it's very lucrative for these companies to have pre-rolls. Viafora is the only company out there that offers the entire solution, text, audio, video, and debate in one simple hosted solution to the companies. We've got right now, through our 3 clients, 3 million users on our platform. Bell Simpatico, which some of you may know, is the AOL of Canada. We went back to them after being on the site for about a month. They said they've never had the highest number of likes and engagement on any piece of content on Simpatico, period. That is a direct quote from them. Donbest Sports, a premier destination for Nevada, Las Vegas, is using it to engage a younger, upcoming demographic to their vertical. MMA Bay is another giant out of UK with 24 million visitors. We drove 5,000 additional unique visitors to their site in the first week of install. We raised the time spent on their site by 150% and drove 20,000 additional pages of advertising for them. This is our opportunities pipeline and the clients that we're talking to right now, the prices that we've quoted them. So that represents a $606,000 opportunity. We're working with different networks in Canada and the US with international expansion in mind. Go-to-market strategy is a 2-prong approach. First, we're short to midterm, we're going after premium brands, publishers, networks, and leagues, which will give us leverage as far as marketing is concerned. By having our name beside these guys, we're going to get tremendous appeal. The next stage, and this is where scaling starts to happen, we're moving towards full automation. A user can come to our site, give us their credit card information, download the code, simple instructions, and they're up and running. And that keeps our sales force in check. The business model, it's a reoccurring monthly licensing fee that goes from $1,000 to $10,000 a month per vertical. So Bell Simpatico we're in their automotive section. We're now going into sports and lifestyle and entertainment. That would consist of 3 monthly licenses reoccurring every single month. That requires a direct sales method in phase 1. As we all know, publishers need a little bit of hand-holding, and that relationship needs to be built. Phase 2 is through full automation, which, as I alluded to, is scaling. Our team, very strong in sales and online media experience. Myself, a serial entrepreneur of 15 years. My partner comes from U of T computer science background, again, an extensive internet veteran. We've surrounded ourselves with smart people. Sue McGill comes from Fox Interactive, Yahoo, MySpace. George Berger, former EVP of Alliance Atlantis and the CEO of the Fight Network. And because of all the behavioral and analytics software that we're running in the background, Professor Sri Krishnan, who's the Assistant Dean and the Head of Signal Analysis and Research Department over at Ryerson University. As you can see, we've got revenues right out of the gate, and with reasonable market penetration, we want to reach approximately $10 million in licensing fees alone in 3 short years. On the, our break even comes at the tail end of 2012, early 2013, and we're looking to raise $1.25 million. We're in talks right now with an angel group, but the round is still open if anyone's interested. 50% of the funds are going to go towards hitting these exact sales figures, 35% towards further product dev, and 15% to core operations. What I'd like to leave you with, plug-and-play user engagement and gaming platform for online content sites. We drive continual conversation through rich media, increasing engagement, time, and page views, ultimately increasing the revenues on the publisher's website. We've got 3 clients right now, 3 million users on the platform. We've got a $606,000, that's actually dated as of last week, it's approximately $800,000. We filed for our first patent with Miller Thomson out in March, and we've identified 3 key areas in our algorithm that we're seeking IP for. And my partner and I have invested $250,000 of our own capital into the company. Thank you.
Our next presenter is Martin Sadkin, co-founder of C-Cubed.
Good afternoon. My name is Martin Sadkin. Welcome to C-Cubed Collapsible Ocean Container presentation. Now if I can just work the, there we go. As a current partner and former chief executive of Samson Distribution, my team and I are intimate with the transportation and import of merchandise into and throughout North America. Samson's a North American logistics provider, providing transportation, inventory management, and rate negotiation services for our global customer base. We operate facilities in California as well as in upstate New York, handling thousands of ocean containers each year. Our combined 75 years of experience in the logistics business has provided us with the insight necessary to create a practical design and an understanding of each supply chain vendor's needs, concerns, and benefits of the collapsible C-Cubed container. Our experience and industry knowledge has enabled us to develop an effective sales and marketing strategy. Our management team consists of our principals, the Samson Distribution management team, and a small group of advisors. Our problems begin with the fact that the United States imports twice as much merchandise than we export. After all, we are a nation of consumers. For every 2 containers of merchandise imported into the United States, 1 is returned to the Far East empty. Who's paying for these ships and containers returning to the Orient at 50% capacity? I think you might suspect the answer is we all do. The U.S. imported 28 million ocean containers in 2008. 14 million containers were returned to the Far East without any cargo. So what's the cost of returning an empty container to the Far East? Almost $2,400 per container. So we know that 50% of the containers are returned empty to the Far East. What about the other 50%? Well, 9 out of every 10 of these containers must be repositioned from an importer's facility to an exporter's facility at an average cost of just under, are you ready for this? $1,300 per container. Let me explain. A container's got to be picked up at an importer's facility, shipped anywhere from 10 to 500 miles to a storage depot, and then 3 to 4 weeks later, is then ordered out to an exporter's facility, again, usually traveling several hundreds of miles. Oh, did I mention containers spend over 50% of their life idle in storage? The result is that 19 out of every 20 imported containers incurs a large repositioning expense, representing a $41 billion annual cost to importers. $41 billion. It's crazy. Our solution is to change the physical design of an ocean container, a design that when empty collapses to just 1/4 of its erect height. The C-Cubed design has been engineered to meet all of the current ISO standards, including the ability to stack and lock into place one collapsed or erect C-Cubed container on top of another or onto a standard ISO container. It's very easy to use. The ISO is the International Standards Organization based in Geneva, Switzerland. They are the authority specifying ocean container configurations. 4 collapsed C-cubes are identical in height to one standard ISO container. Each member of the supply chain can quickly collapse and erect the C-cube without any new equipment in less than 3 minutes, with only the use of a forklift. Since 4 collapsed C-cubes can be trucked one on top of another or 8 stacked on a rail car, gross transport expenses will be reduced by 75%. The expected net result will be a reduction in repositioning costs to the Far East from just under $2,400 to less than $900 per container trip. Now for a few metrics. Containers average 6 round-trip turns per year. The C-cube provides a gross savings of $6,600 each year, or $1,100 per trip. The minimum expected life of a container is 7 years, representing a gross savings of $46,000 per C-cubed over its minimum expected 7-year life. We're estimating a selling price of less than $6,000 per container. The return on investment at 6 turns per year will be in excess of 800%. 99% of the world's ocean containers are owned by 2 groups of businesses, shipping lines and container leasing companies. They combine to purchase 2 to 2.5 million containers each year. The top 20 owners control over 60% of the global inventory. The UN has forecasted the growth of global container inventories from a current 18.5 million containers to over 24 million containers by the end of 2015. Shipping lines strive to maximize their profits. If there's not enough available containers where loads are waiting, the shipping lines will lose margin. If they had a cost-effective means of returning large quantities of empty containers, they would. Our main competition is the current industry ISO container. The 10 largest Chinese manufacturers account for more than 90% of the world's container production. C-cubed will create the initial demand and production of the C-cube container. Once demand has been created, our plan is to license our technology to these manufacturers. We're not the first to design a collapsible or folding container, just the first to make it practical. On screen is a recent competitive product with numerous real constraints. Competitive designs fail due to 2 common problems. First is ease of use. Each party of the supply chain has to be able to fold or unfold or collapse or erect the container in a minimal productive amount of time. Number 2, all of these designs require additional equipment to handle, store, and/or process the container, requiring additional investments from each of these supply chain vendors, which isn't very likely. The competition gets caught up in their economic cost-benefit analysis without concern of whose cost, whose benefit, and discounting the cost of the process and handling requirements of their designs. The next hurdle for a prospective market entrant is physical proof of concept, life cycle testing. It's absolutely 100% necessary to prove that a new container design can withstand the elements, specifically weather and extended exposure to salt water, hold up to the vibration, shear, and stress of being transported thousands of miles each trip, and of course the ability to collapse and erect the container several hundred times without a major breakdown. We're working with MGA Research as our testing vendor. MGA provides automotive and mechanical testing in 5 facilities across the country, and they're headquartered locally in Akron, New York. Annual maintenance is to be expected. We will provide guidance to our customers. C-cube management has direct relationships with a number of container owners, including the 2 largest, Textainer and Maersk. Discussions with America's largest importers has provided us with more incentive to push this project further. Walmart estimates that they could save in excess of $70 million per year just in returning empty C-cubes to port 4 at a time. Textainer is of particular interest. They're the U.S. government's vendor of choice, currently leasing them 127,000 containers. The U.S. Department of Defense is a key potential account. It'll be necessary to produce 3 prototypes. Our plan is to build 1 to approve before commencing the next 2. 2 will be used and most likely be consumed during the life cycle testing. Manufacturing of C-cubes will occur at a C-cube controlled manufacturing facility. Prior patent experience has led us to write a defensible patent with key unique claims utilizing an experienced and savvy legal team. The CQ PCT patent assignment expires in 2028. Revenue and profits will grow rapidly following the initial introduction. We expect to fulfill 10% of demand by fiscal year end 5, resulting in year 5 revenues of $82 million, primarily in license fees, and an EBITDA of $62 million. To enable C-Cube to reach our goals, we're seeking an investment of $500,000. Prototype production and lifecycle testing will be a $250,000 spend. To date, we've invested $135,000 and counting. We will continue to invest with you into the future. We hope you enjoyed the presentation. Please help us realize this disruptive shipping technology. Thank you.
Our last presenter, Dr. Lonnie Berkman, founder and CTO, LifeCell DX.
The fertility diagram, which is a very personal issue. It has struck many good families, humans and people out there, and there are some key words that I want you to keep in mind, and we're going to introduce an area that is novel, provocative, someone said very sexual, yes, but very personal, very telemedicine. Keep in mind male infertility tests going through the internet. We are the first to do digital video files to handle this issue around the world. And we are introducing a social media context for taking care of infertility. We are setting the standard in high-tech fertility testing in some very unique ways. There are words that I want you to notice here. We are setting up affiliate sites globally, centralized here in Buffalo. We are certified. We've been doing this for a long time. We are revenue positive, patent pending. We are the first in the market, and we have some unusual ways of taking care of physicians, hospitals, and patients around the world. Everything is in place today. We have been very busy the last year and a half. We are scalable. We are looking for somebody to jump in and say, join us, go. Infertility is a $12 billion market around the world. Our ask today is $1 million. Our break-even point is going to happen during 2012. We are utilizing the internet platform in a very unusual way. Infertile patients are the driving force, not the physician. Most cities do not have access to any expertise in this area. It is simple, it is accessible in any country, and I'll mention a number of them there. We are able to predict fertility potential, and that is not where the rest of the world is. We are able to take our testing and our methods through secure internet transmission. Everything is certified by New York State Department of Health. Videos running through the internet and their analysis. Proven SOPs and proprietary solutions of monitoring. What is the problem out there? Infertility is huge. It is growing. There are at least 10 million in North America dealing with this issue today. 70 million in the world, and they have blocked left and right. $2 billion were spent in 1988 to take care of infertility. There are no new numbers for today. If you think that it's about double of that. Half of all infertility comes with a surprise to many people is due to the male part. HMOs focus on the female. Surgeries focus on the female. The talks about treatment. Half of all infertility is the male and that. The only thing that is available today is the basic semen analysis, and that little test, go count the sperm, cannot show that couple whether she is fertile. It cannot show them if she is fertile, and that is the question that they have. Half of the patients out there were led into a wrong treatment. There is tremendous frustration
are throwing money at it. These patients have money. That is not their issue. Throwing money at adoption, in vitro fertilization, I think you probably know somebody who's gone through IVF once, twice, 3 times, and does not have a baby. Or choosing donor sperm, that's $2,000. And he is not the father. Happily, they have a baby. Now you compare these 3 to Lifestyle DX, here asking $400 for a sophisticated, digitized analysis of whether these sperm are functioning correctly. Yes, it will count them. It will tell you your need, but the patient and the doctor gets much more than that. The point is, cash is not the problem. These patients are limited in where they can go to find cancer. They will pay to get an answer, and the question is my partner safe? The solution to Lifestyle DX is one. We're the internet right now. Send the sperm to the internet digitally. Send it to our central laboratory here in Buffalo. We will take care of it. We are experts in the Android area, in the computer cracking area, in sending out reports, in working with physicians, and in special testing of patients. Lifestyle DX does the highest quality analysis of any human analysis. I have seen 2,000 Washington cases around Western Life in the last 15 years, and we are now leaping to the next level. We are not new to this business. We are now able to take remote patients, and I mean remote. We have sites that are possible. People that we have trained and are sending back to India, Montreal, Syria right now. I'm flying to Greece. I'm flying to Japan in a month. Greece has called us. Pakistan has told us. Whatever is happening in the U.S., infertility is bigger than the other countries. If there are wealthy people in any country that you can think of, they will pay to have that baby. I need a boy, I need an heir, I need a child, and they will pay. Global access is no problem. We have patent pending methods, everything is kept secure, and most of that doing it. It is very individual and comprehensive. The patient can stay in their city with their doctor as opposed to going back to a laboratory in the country. I stopped taking insurance 6 years ago. We're negotiating with basic money, but these patients will pay. They pay to pay. Half of all reports that go out to you, your friends, your sons, your neighbors, half of the basic sperm count is down the road today. 50% of it is misdiagnosed. On the left, almost 70% of the men who will get a semen analysis report will say, you're okay, you have good sperm, you're moving. Must be the female. HMOs will spend $5,000, $10,000 for IUI. But if you apply our numbers to the same guy, half of them, the 70% has now dropped to the blue on the right, 35%. That is a tremendous amount of frustration for the physician and for the public. They want an answer. Tell me. If it's really not working, tell me. Our business model is, an answer to that is in the upper left, extensive marketing. We are just now entering into a relationship and partnership that helps us with internet marketing and the web. Everything is ready to go, and we are now working. Extensive marketing primarily to the infertile couples because they are the driver. They are the ones who want. They are the ones who want to work. We are setting up affiliate sites beginning in New York and several other places like in around the world. The video files are made at the clinic with equipment that we provide to them. Very specialized. With our proprietary method. The video files are sent come to us securely. We are able to analyze it and then report to the back. It is a very Island and the Thurston North area. They get a fee for providing this service, and they will see that patient 5 or 6 times in reports, diagnostics, surgery, and that patient, that doctor, that friend wants to be coming in. What makes us different? Over on the right is the traditional smear analysis, and this is what they do every year in the world. 70 million patients having an analysis put together. Cannot predict. They eyeball without motive, and no claim can help. We can predict 90% accuracy. These sperm will first. Those sperm will not first. And we've been doing that for 50 years. Quantitative, computer tracking. Our method is certified. Our report is very detailed, and there are 3 of us as experts as well. We are a high-margin operation. If you come over to the site, everything is in place. When you're technically in training, we have 3 PhDs ready to go, and all the equipment is ready. We have steps ready for our application. And by year 5, looking at U.S., North America, and global, we expect to be up around 30 billion. The number of sites that we expect in the U.S. and the world are expanding to 20. Give us some funding. We have the resources and we're ready to go. Our management is much stronger than what it was 2 years ago. I'm happy to say that we've had several very experienced executives assisting us at this moment. I am a specialist in reproductive physiology. Fran Law has joined us recently as an acting CFO, totally experienced in strategy. John Ross has joined us recently in the consulting area and business strategy, strategic planning, and I feel pleased to have this support. Our advisory board is broad across many cities and many cultures. Both computer tracking, Terry McCoy, Scott Friedman, a guardian, Trevor Steele, who's been in the reproductive area for a long time, Grayson Toller, Ben Bolt, and other very experienced advocates, Kim O'Brien in Philadelphia helping us with our business. Our progress has touched on a number of areas. We are now out of children's hospitals. Our methods were certified by New York State. We filed our utility package application. Last year was critical in moving to a full suite and building a complete laboratory. Our 4th affiliate site signed up. Our validation is complete. We're preparing to form a launch. We would like you to join us. And I want to mention that recognition has been coming left and right in a very wonderful way. Brown Brothers Harriman at the bottom called us. And we were very excited. New niche market, this is a go, we want to be with you. And Korean TV coming to us. We are very prepared in all areas that I mentioned: hardware, software, consumable kits, validation, certification, new med tech, scientists available in and ready to go to do thousands of these videos at a time. We're in very rigorous market, so having us validated and certified is important. We have a new partner who is considering Movies.com working with us during the social media and the market to be done for us. Filling that gap, social media is best practice. We want to do this. In the pipeline, new process. We have a diverse product area. This is the equipment that goes out to the physicians. We have unusual tests and unusual ways of measuring if the sperm are fertile. I invite you to join us, come over and see a little bit over in our display, and thank you very much.
I'd like to first thank Jennifer and Phillips Lytle for moderating this particular session. Thank you also to our companies that are presenting. We are actually running right on schedule here, so we'll have lunch being served at 12 o'clock at Clifton Hall. So I encourage all of you to take the scenic route, if you will, at the gallery to Clifton Hall, where Hatim Tiabji will be proceeding with his talk around 12:30, but lunch again will be served at 12. So I encourage you to continue your journey up to Clifton Hall. Thanks so much.